Think your blood pressure monitor is giving you the full picture? Maybe not, because if you're not using it exactly right, those numbers might be lying to you. Hey everyone, I'm Elena from Universal Product Guides. Let's get started. Today we're taking a closer look at the Oklar Blood Pressure Monitor. One of those devices that seems simple enough. One button, one cuff, and you're good to go, right? Well, not quite. Because when it comes to your health, accuracy is everything. And that starts long before you press that start button. So today, I'll walk you through the easy but often missed steps to make sure every number you see is one you can trust.
Hey everyone, today we're talking about a little device that so many of us have at home, but we might not be getting the most out of it. I'm talking about your home blood pressure monitor. Getting this right is so important because good data is everything when it comes to understanding your health. So let's dive in. You look at these modern monitors like this one from Oklar, and they look great, right? Super sleek, user-friendly, one button and you're good to go. Well, maybe not. Because here's the honest truth. A fancy design doesn't mean the reading is accurate. And an inaccurate reading, that's actually worse than taking no reading at all. And that really brings us to the big question, doesn't it? Are the numbers you're seeing at home telling you the real story? Over the next few minutes, we're going to walk through the simple but absolutely crucial steps to make sure every single number that pops up on that screen is one you can trust. First things first, let's talk about what happens before you even think about pressing that start button. This is probably the most overlooked part of the whole process, but it's the absolute foundation for getting an accurate number. The American Heart Association has a really clear guideline on this, and it all starts with what I call the 30-minute rule. It's simple. For a full half hour before you measure, you need to let your body get to a calm, baseline state. That means avoiding a few common things. So what are those things? Well, it's the usual suspects. You got to avoid caffeine and nicotine, since they can temporarily make your arteries constrict. Same goes for exercise, which obviously gets your heart rate up. Alcohol can mess with your readings too. And yeah, even a really big meal can shift your blood flow and throw the numbers off. The goal here is to measure your body at rest, not your body reacting to something. Okay, so that 30-minute window is up. Now it's time to get into position. Just remember this little mantra. Sit still, stay silent, and stay supported. This is all about creating a totally stable environment for you and for the monitor. And here's exactly what that looks like. You're going to sit quietly, and I mean really quietly, no scrolling on your phone, for 5 full minutes. Let your body settle, make sure your back is supported, and both of your feet are flat on the floor. And here's a big one. Do not cross your legs. You wouldn't believe it, but that simple little action can artificially raise your reading by up to 8 points. And last but not least, make sure that cuff is on your bare skin, never ever over a shirt sleeve. All right, so you've completely mastered the prep work. Perfect. Now let's move on to the actual technique. We're going to look at the 2 most common types of monitors you see out there, the upper arm and the wrist models, because how you use them is a little different. So here's the main difference. The upper arm monitor is pretty much the clinical standard. It's what doctors prefer because it measures from a big, major artery, which makes it a little more forgiving. The wrist monitor is awesome for convenience, but there's a catch. It measures from a smaller artery, which means your positioning has to be absolutely perfect to get a good reading. Now, for that upper arm model, it's pretty straightforward. You'll want to place the cuff about 2 fingers width above the bend in your elbow. Check that it's snug but not choking your arm. You should be able to slip 2 fingers under it. Then, rest your arm on a table so the cuff is level with your heart, press start, and just relax. Stay still and quiet until it's all done. Okay, for the wrist model, you really need to pay attention to step 3. This is everything. Once the cuff is on your bare wrist, you rest your elbow on a table, and then you have to physically raise your wrist until that monitor is exactly level with your heart. If your wrist is too low, the reading's going to be high. If it's too high, the reading will be low. I'm not kidding. This single step makes all the difference for wrist monitors. So, you've done all the prep, your technique was flawless, and now you have your numbers. But what on earth do they mean? Let's break it down and turn that data into something you can actually understand. First up is that top number, your systolic pressure. The easiest way to think about this is as the peak pressure. It's the amount of force happening inside your arteries at the exact moment your heart contracts and pushes blood out to the rest of your body. And that bottom number, that's your diastolic pressure. This is the pressure in your arteries when your heart is relaxing, in that little pause between beats. It gives you a good idea of the baseline pressure your vessels are under all the time. This chart right here gives you the clinical context for those numbers straight from the American Heart Association. You can see all the categories from normal all the way up to hypertensive crisis. But please remember, the most important thing is not one single reading. It's the pattern over days and weeks. That's the real story, and that's what's worth talking to your doctor about. But what if you do everything right and you get an error code? Don't worry, it happens to everyone. Let's do a quick lightning round of the most common errors and how you can fix them in like 5 seconds. If you ever see an E1, it's almost always a simple air leak. The fix is super easy. Either the cuff is a little too loose or the air tube isn't plugged in all the way. Just rewrap the cuff so it's snug and double-check that connection. Boom, problem solved. An E2 code just means the monitor caught you moving. This goes right back to that sit still, stay silent rule. Maybe you talked or coughed or just shifted in your seat. No big deal. Just wait a minute, take a nice deep breath, and try again without moving a muscle. And if you see an E5, please don't panic. The machine is not saying you don't have a pulse. It just means it couldn't get a clear signal. This almost always happens because the cuff isn't positioned quite right over the artery. Just adjust it a little bit and try one more time. Okay, so let's zoom out and bring this all home. Because the real reason to do home monitoring isn't just to collect a bunch of numbers. It's about building a story, a real, meaningful story about your own health over time. And this quote right here says it all perfectly. Any one reading is just a snapshot, a single moment in your day. Maybe that one high number was just because you were stressed or you just had a coffee. But a series of readings, that's what shows you the trend. And tracking that trend is the real goal. You see, at the end of the day, the number on the screen isn't the final answer. It's the starting point for a better, more informed conversation with your doctor. When you can bring them a log of accurate, consistent data, you're not just a patient anymore. You're an active partner in your own healthcare. So as we finish up, I'll just leave you with this one question to think about. When you start doing this the right way, every single time, you're not just taking your blood pressure. You're writing a diary of your health, one day at a time. So, what story is yours going to tell?